I'm Fiona Miller. I'm a professor here at the Institute of Health Policy Management and Evaluation, HPME. I'm here with my colleague Nicole Sims, who's a research officer at HPME. And I'm going to host the conversation, provide a bit of an introduction, and turn it over to Nicole. So this is a report back, and we're recording this for the future. We'll put it on HPME's website. This is a report back on an event that we held March 25th of this year, which was a really interesting event to think about the intersection between patient engagement and partnership and healthcare sustainability, health systems sustainability. It's the product of the work of two committees at HPME, one of which is focused on the issue of patient engagement, engaging patients, family members and caregivers in their own care, but also in thinking about the organization and design of healthcare services and systems. Under the principle that co-design makes services better. So engaging patients as partners in thinking about how healthcare systems and services operate is going to make them better, but also out of a recognition of the rights of the users from a democratic perspective to have that kind of a role. The Environment, Climate Change and Sustainability Committee exists really to see how we can support healthcare organizations to reduce the negative environmental impact of healthcare, because healthcare is, despite its commitment to support health, actually detracts from health in some ways because of its negative environmental impacts. And also because healthcare organizations and systems need to adapt and be resilient in the face of things like climate change and other environmental challenges, and can play a leadership role in helping communities to transition to a more environmentally sustainable future. So we worked together because we thought there was something very interesting about the question of the role of patients as partners for more sustainable health systems, because patients can be engines for change, because patients need to be consulted in efforts to make healthcare systems more sustainable, and because we thought there could be some really interesting synergies, some points of intersection where the kinds of things that patients want or need from their care are actually changes to care that would make healthcare less environmentally harmful. And as we put together the symposium, we knew full well that we were doing something novel, and that there was no one who was really working at that intersection with expertise both as a patient partner and expertise in environmentally sustainable healthcare. So we structured the half-day symposium very much to reflect the need to bring two communities together, to bring those with the expertise as patient partners and those with expertise in relation to healthcare sustainability. So we had two keynote speakers speaking from both of those communities. We had co-facilitators of our breakout groups speaking from those perspectives, and we had half and half representation on our report back panel of the facilitators to make sure that that expertise could always be shared. When we set up the workshop, we very much planned on developing a report, and then we got the fabulous suggestion to do this as another way to continue the conversation that we started in March, and we hope to continue the conversation. And after Nicole's talk, we'll come back to me, and we'll talk a little bit more about the next steps and how we want to continue to move this agenda forward. Thanks.
Just a moment, I'm sorry. Okay, slides are moving. So we will be doing a Q&A at the end of the session. So if you have any questions or comments as we move along, please post them and we will get to them at the end. Okay, so I am just going to spend a little bit of time going through the report that we composed based on the work leading up to the symposium and then the symposium itself. So it's a 32-page report. It includes the background information on healthcare sustainability and patient engagement. It also sort of summarizes the evolution of the symposium and then really summarizes the symposium itself. It synthesizes some of the key lessons that came out of the planning and execution of the event. And that's really what we are going to focus on today. The report also includes links to the video of the keynote speakers. We also have a video of the report back panel as well, so that is accessible to anyone who is interested in checking those out. So just a brief note, Fiona already mentioned the keynote speakers. So we had Rachel Stancliffe from the Center for Sustainable Healthcare in the UK, and she really talked through what sustainable healthcare is all about, how can we go about making healthcare more sustainable, and she gave some really interesting examples of some of the work that the Center for Sustainable Healthcare is doing. And we also had Emily Nicholas Engel. She talked about her experience as a patient in the healthcare system, how she came to be involved in advocating for patient engagement. And then she went into a discussion of what patient engagement is, some of the challenges to patient engagement, the sort of growing acknowledgement within health systems of the importance of patient-centered care and patient engagement. And then she talked a little bit about how patient engagement and sustainable healthcare might fit together, which was then the focus moving on from the keynotes. And really what we wanted was for both of these keynotes to sort of provide a background for both of the communities in attendance so that they had a solid sense of what each community was all about. So following this, we had a breakout session in which everyone got into small groups, and they thought about whether or not there was a common agenda between the patient engagement community and the environmental sustainability and healthcare community, and sort of, if there was, how these two groups might be able to work together in achieving it. And they looked at these questions at various levels of the healthcare system. And then we had a report back panel, and as Fiona mentioned, we had some facilitators from each group come forward and really share the group ideas. So as we talk through the key lessons from the day, these are really some of the major questions that emerged after planning the event, hearing the keynotes, seeing the notes from the breakout sessions, and then reviewing that footage that we have from the report back panel. So these are really the questions that it seems need to be addressed in order for these two groups to move forward together in a productive way, if that's what they choose to do. So first question, is there an interest in collaboration from either or both communities? Second, how might the interests of these communities overlap, and can a common agenda be developed? What is needed to move forward together to co-design environmentally sustainable health systems? And then how do we actually go about doing this? So how does each community mobilize for health system change? And can there be a sort of shared strategy that is employed to reform healthcare systems so that they are more environmentally sustainable? So we'll just go through each of these lessons. So first, is there an interest in collaboration? So when we put out the invitation to the event, our registration max was very quickly met. We enlarged the capacity, and again, it was met, so people were waitlisted. We had a really diverse mix of attendees at the event, so we had a lot of people from the patient engagement community, from the healthcare sustainability community, and then we also had others, administrators from healthcare facilities, students, researchers. So it was a great mix of attendees, and overall it was just a very positive response to the event, both before the event, during the event, and afterwards. So we think it's a pretty resounding yes, that there is definitely an interest in collaboration coming from both of these communities. So now that we've established that, we need to think about how a common agenda can be developed. So there are a few ways in which there are common agendas that participants at the symposium discussed. First, patients are critical stakeholders in health systems, and many of them have a desire to engage on healthcare sustainability issues. So a lot of patients are very interested in environmental sustainability. Because they are on the front lines of the health system, they're in a great position to identify sustainability issues And as the importance of patient-centered care is increasingly acknowledged, patients do have more and more influence over healthcare administrators and policymakers. So it just makes a lot of sense for the sustainability community to want to partner with patients who are interested in these kinds of issues. And then we also saw emerging in the discussion that there are a lot of sustainability issues that, when addressed, actually improve patient-centered care and vice versa. So there were a lot of different interventions that were discussed that could end up meeting the needs of both of these communities. Even though their needs might be distinct, a common intervention can address different needs. So things like e-health, care coordination, targeted food provision, social and green prescribing, smarter manufacturing, and a focus on prevention and the social determinants of health. These are all interventions that can address the needs of both groups. So I just want to focus on a few interventions in particular: e-health and care coordination, and then targeted food provision. And within the report, we give these examples. You can see here, we've got the patient concern, we've got the sustainability concern, and then we've got initiatives that serve to address both sets of concerns. So, for example, patients are concerned about the time and resources that they need to devote to their care, to getting to and from appointments, coordinating care, and sustainability advocates are concerned about transportation-related emissions as patients and caregivers travel to and from care facilities. So some initiatives that can address both of these concerns include e-health innovations. So patients and caregivers can check in online with physicians. There are apps that can allow patients to report on their health stats and to check their health stats, and this reduces travel to healthcare facilities. Better coordination of care so that appointments can be grouped together can also reduce the number of visits that patients need to make. So again, these are interventions that address both sets of concerns, even though these concerns are distinct. Same with targeted food provision. So while patients might be concerned that their individual preferences and experiences aren't considered in the food that they are given in healthcare facilities, and sustainability advocates might be concerned about the harmful environmental inputs involved in food production and in the food waste that hospitals produce or other healthcare facilities, targeted food provision can address both of these concerns. So having sustainable local food sources, customizable menus for patients, that means that there will be less harmful inputs, less environmentally harmful inputs in the production of food, and food waste will be diminished because patients will actually eat the food that they're given. So these are some examples of the sort of way in which these two communities can sort of have a common agenda. So we've got that agenda. How do we move forward together? So there were really three things that participants identified as necessary in order to move forward together. And these are awareness building and education, shared accountability, and evidence indicators and evaluation frameworks. So I'll just talk briefly through each of these. So when it comes to awareness building and education, there are several different stakeholders that participants identified as needing to know more about the environmental impacts of health systems. These include patients and caregivers themselves, healthcare providers, workers, healthcare facilities, governments, even the public. So there needs to be a sort of much broader understanding within the community about the environmental impacts of healthcare. And we need to have this education in order to produce sustainability champions and leaders who are going to really push the sustainability agenda forward. And so that when they do that, they're met with administrators and policymakers who are actually receptive to what they're trying to do. So a lot of participants talked about this need to really develop a shared vision around environmentalism. So as one of our facilitators noted, it's really important to stop thinking of environmentalism as just products or garbage or emissions, that we need to think about there being a better environment as a whole system that makes for better health. So really connecting the environment to health. So moving away from this sort of individual perspective to a global look, thinking about how we're all connected to the environment no matter who we are. with respect to shared accountability, all of those different stakeholders that were identified as needing more education on environmental issues were also discussed in the sense of them needing to take accountability for the role that they are playing in producing the environmental impacts of the health systems, and also what role they can play in trying to address these impacts. So it's important to identify who is involved and what they're responsible for. How can we actually hold these various stakeholders accountable for meeting these responsibilities that we've identified? And also, how can we identify opportunities for collaboration so that these different groups are not just working on their own, but they are working together on coordinated efforts to improve health system sustainability. And one discussion that really pointed out some of the difficulties involved in these kinds of coordinated efforts centered around this notion that there's really no home at present where patients can go to say, you know, we have these concerns about environmental sustainability in healthcare. So as one of our facilitators noted, that makes it very difficult to move ahead, and she really advocated that anyone who is interested in these issues and in finding a way to collaborate on them needs to find a way to come together and have a home where ideas can be shared and leveraged to get momentum. In terms of evidence, indicators, and evaluation, it's clear that we need more and better data on the environmental impacts of healthcare. We need evaluation frameworks to measure the success of any interventions that are made to foster sustainability. And we need to think about how existing hospital metrics on safety and performance can be changed to include sustainability criteria. So as one of our facilitators noted, we need better measurement, better demonstrated impact to make the case for making this kind of change. And a lot of change won't happen unless there is this upfront investment. So yes, it is an investment. Yes, it needs to be determined who's going to do this work and how, and maybe we'll talk more about that later, but it's definitely, we definitely need this data to move forward. And one of our other facilitators noted that we also need to think about the kind of metrics that we are measuring. So as contained in this quote, she says that the metrics aren't measuring what is important to patients. So the metrics are measuring system level issues, it's top down, nobody is asking patients what the metrics should be. And when you look at the value in healthcare on every level, the value is defined as value to patients and patient outcomes. But what we see in healthcare is not reflecting this. So why doesn't accreditation take into account environmental sustainability? Why is accreditation only looking at hospital-centered metrics that come from quality improvement, which currently is also not environmental or patient-centered? So it looks like the environment and patients are the two outliers here. So how can we really get these two things on the agenda when it comes to the kinds of metrics that are being measured? So in thinking about mobilizing for change, so as we try to get these pieces in place of the knowledge building and translation, the metrics that we need, what kinds of strategies can actually be used by the patient engagement community and the sustainability community to move forward together? So I'll just talk through some of these main ideas that came out of the symposium. First, that it's important to develop a shared vision of sustainable healthcare. It's crucial that tokenism is avoided, and there are many diverse, there are many collaborative strategies that need to be pursued in tandem. So first, developing a shared vision. So it's really crucial that patient and caregiver values are incorporated into a vision for environmental sustainability in health systems and incorporated into whatever approach is taken to make that vision a reality. So as one of our facilitators said, the discussion really needs to start with the philosophical underpinnings and an articulation of the values that drive sustainable healthcare, and strategies need to be informed by shared values that patients and family members should be participant in describing. Avoiding tokenism. So a lot of participants expressed a concern that that patients might be engaged on these issues in a very sort of cursory way, just so that greening healthcare organizations could say that patients were involved, and they really don't want to see this happen. So they don't want to see patients engaged because it's good marketing or because you can put a family advisor beside a picture of a green leaf and say, look, we listened to our patients about environmental sustainability. They really want to see meaningful engagement of patients on these issues. In terms of the collaborative strategies that were explored, I'll just go through this list of some of the suggestions that were made. So including patients and caregivers on green teams, including patients with interest in sustainability on healthcare advisory boards, using social media to allow patients with interest in environmental issues to connect with one another. Again, going back to that idea of the home base, is there a way to establish a home base for patient engagement on health system sustainability? Perhaps we can match up patient engagement champions with environmental champions so that they can really explore how to move forward together. Several participants raised the idea of exploring the language of corporate social responsibility so that healthcare organizations start to understand the responsibility that they have to think about environmental sustainability and patient engagement. Ensuring that patient values are informing processes like procurement and quality improvement so that these can be leveraged to achieve environmentally responsible purchasing and practices. So going back to that comment from the facilitator that things like quality improvement don't include sustainability, well, maybe there's a way that they can. So we need to think more about that, and some work to that effect is already being done. We actually just had a webinar on it. And then finally, create accessible opportunities for patients to engage on sustainability issues. And one of our facilitators gave what I think is a great quote, to start small, but start now. So let's think about what we can do now to get the ball rolling on this. And just to give an example of this last suggestion to create accessible opportunities for patients to engage on sustainability issues, one of our facilitators, who is a physician, gave this fairly simple example of having feedback systems like surveys and suggestion boxes in waiting rooms on environmental issues, where patients can start to think about sustainability as something that they can consider about their healthcare experience, and this would encourage leaders to think about patient voices in that regard. But it's also just a really easy way for patients to use the time that they have in the waiting room to voice some of the concerns that they might have about sustainability. So the report does include a sort of one-pager where we summarize the events, and then we offer some suggestions about how different stakeholders can start to move forward right now to begin to explore this collaboration and explore moving forward together in addressing sustainability in healthcare. And you know, we advocate that green healthcare organizations really think about how they would benefit from including patients and caregivers in their efforts. That patient organizations might want to think about the fact that they do have some interests that can be served by the initiatives that are being advocated by green healthcare organizations, and they might want to explore leveraging a partnership with those efforts. Educational institutions can start to work towards building this evidence base that we need to really get buy-in from administrators, from policymakers on improving sustainability in healthcare systems. Healthcare organizations need to start thinking about the triple bottom line, and this is something that Rachel Stancliffe discussed in her talk, that they need to be attentive to the environmental, social, and financial costs of everything that they do. And then formal care providers, how can they think about identifying champions, developing networks of better practice that can improve patient care and address environmental sustainability. And then finally, decision makers, if they've got these larger mandates to meet, for example, climate change targets, they really need to start thinking about health systems in their strategies and plans and decisions, because there are huge opportunities for sustainability gains in the healthcare sector. So those were some of the main things that came out of the event, and all included in the report. And I will hand it over to Fiona to talk about what we're going to do next.
Great, thanks very much. It's a super summary and a great report. And I hope that you'll find it useful. So we'll just briefly, we'll obviously do the things that we can to get that report out. and including some sort of targeted information sharing with some of the organizations that we identified as needing to hear this message. But one of the key things we wanted to share with you is what we got from this effort, from this initiative in terms of work that we're doing at HPME, and that is the launch of a Center for Sustainable Health Systems. So I don't need to repeat this message, but we do think that there is a burning platform for more effort by organizations like HPME, an academic organization which really does have a responsibility to conduct the education, conduct the research, and engage in the partnerships to support healthcare organizations and patients to build more sustainable healthcare systems. And here's the place where we really learned a lot from the March 25th event, that we think that in moving forward more actively in the efforts than a committee can do, that one of the key ways in which the sort of secret sauce we have to help, because we're not the first to try, there's a lot of great green organizations trying to advance sustainability in healthcare, and they will continue. So we're not the first to work in this space, but we think that we have something distinctive to offer, and part of that very much is a focus on patient engagement and partnership in improving the sustainability of healthcare, but also focusing on healthcare managers, administrators, directors of units, ordinary folks who have an interest in these issues but don't yet know how to advance the agenda. We can help them learn how to do that, in part through a focus on patient partnership, but also through quality improvement, by using the tools of quality improvement and sustainable quality improvement to make these kinds of changes within their healthcare organization. So this was something that we learned that was critically important from the symposium in March. So in terms of what we'll be doing, these are very classic academic activities. This involves education, research, consultation, and services. So I'm not going to talk about that in any detail, but I do want to announce, I think for the first time, we're talking about something we're going to be doing in education, which is a masterclass in sustainable healthcare. We're launching this in September. We're hoping that people like you, patient partners, but also managers, administrators, healthcare professionals will find it helpful to learn in 2 days with us about first the environmental impacts of the healthcare sector, but then really get some of the tools that they need to make the changes. So really thinking about adaptive leadership and change management, and also quality improvement and engaging patients throughout these processes. How do we use the quality improvement toolkit to advance sustainability in healthcare? So hopefully we'll see some of you there in September. And now, do we have any questions? I'll turn it back to Nicole for this.
If anything has come up. Okay, well, in the interim, while you're thinking of something, I just want to say thank you again for your participation at the symposium and for coming to tune into the webinar today. We really, the report that we wrote came out of the notes that the note takers took at the breakout sessions, and then the summaries that the panelists, that the facilitators provided in the report back panel. So as I mentioned, when I sent the report out to everyone, we really hope that you feel like this report kind of belongs to you too, and that you can, you'll send it out to whomever you think would be interested in this kind of work. And
I think it's time to close it up.
okay.
This has been great. Apologies for the technical difficulties. We will be sure to get some new equipment, it looks like,
Yes.
we need for further webinars. And please do be in touch. Our email addresses were available there. Not too hard to find. Me, Fiona Miller at utoronto.ca. And so so please do be in touch. We're very eager to continue this conversation with folks in the wider community.
Yeah.
And somebody's just written in to say it was a great symposium. I was pleased to participate. So thank you very much to folks for this.
Yeah.
Okay.
Thank you.
Take care.
Bye.